My name is Steve Moak, and I'm CEO and founder at Sharetek. You know, I get asked quite often, why start a drug testing company? The answer is very simple. I'm a person in long-term recovery from substance use disorder. I have been drug tested 100+ times in my life, whether that was for pre-employment, whether that was for counseling, being in treatment at a sober living when I was younger, just to try and get my parents off my back. And what I found is that that process has not changed in decades. There are point-of-care cups that are prone to failure, or whether it's false positives, false negatives. There is drive into a clinic and have someone observe your collection, which is just traumatizing, stigmatizing, and really just an archaic way of doing drug and alcohol testing. You know, I firmly believe that one day we're going to look back and wonder, how was observed collection ever an acceptable practice? The other issue with drug and alcohol testing is that it can be cheated fairly easily, right? Whether that's hair, you can use a shampoo, it could be sweat, which is a kind of ineffective way to do testing because it takes a while to get the results. Blood is awfully intrusive and requires a visit to a clinic and then days to get the results. And then there is urine, which, no pun intended, is really the gold standard for drug and alcohol testing. But again, observed collection requires eyes on streams, and I hate to be graphic, but that really is an important part of this. And the reason why is because it's fairly easy to cheat, adulterate, add, use synthetic urine, or just maybe use a prosthetic. And Google Wizinator at your own risk, but these are real devices that are all built around cheating drug and alcohol testing results. We at Sharetek just felt like that was an unacceptable way to have such a critical part of the substance abuse recovery process. We really set out on a mission, and that mission is to eliminate the world of observed collection drug testing. And I believe that when we say it. And what we have built here at Sharetek is a step in that direction now. You know, the Sharetek model is DNA confirmed at-home drug and alcohol testing. So right now, we sell this directly to providers, whether that's a virtual outpatient or a treatment center, a telehealth provider, or really the folks that we have started servicing with this product and have since ramped up and expanded into other verticals such as criminal justice. And that involves diversion or reentry or probation or parole. There are pre-employment, post-accident organizations, sports organizations, private schools, family law. There is a host of verticals that use drug and alcohol testing for a wide variety of reasons, and we really felt like the drug and alcohol testing space needed to be disrupted. So as part of my journey of being in long-term recovery and having been through the testing process many times in many ways, including efforts on my own back when I was actively using to manipulate those results, and I was able to do that very successfully. So we wanted to create a test that had safeguards to ensure the validity of that sample. Okay, so how do we do that? What is the Sharetek method? You know, we really set out to build a better drug test, and you can find us at betterdrugtest.com. And the way that our process works is we sell these tests, and you can simply go to a portal, you can order these tests, they ship directly to a client's front door. There are very simple instructions on how to perform this test that are included in that package. The first step is to engage in a video call just like we're doing here, or just like you've done on every other Zoom, Skype, or FaceTime that you've ever been on. And with the client, that end user, right, they will take a very unique looking buccal swab, and with inside the cheek, they'll do an observed cheek swab with this buccal swab that will go into a sealed container. Now, this is where the differentiation comes in. That client can take the collection cup and go from the privacy of their own home, not on video in any way, shape, or form, and perform the collection of the urine specimen that is completely unobserved. Now the client will take that buccal swab, which is only done the very first time and requires no other buccal swab for the entire testing duration. We'll take the buccal swab and the urine collection cup, and they go into a prepaid UPS bag. So again, no additional cost throughout this entire process. It can then be dropped off at any UPS location across the country. We've made this extremely simple. That UPS bag with the sample and buccal swab gets overnighted to our lab and gets there the next morning. And the first thing that our lab does is then take the DNA that's extracted from that buccal swab and the DNA that we can extract from the urine sample, and we make sure that those match. And what that does is enable a remote, valid, and accurate DNA confirmed at-home drug testing process. We then take that urine sample and we perform the most comprehensive toxicology on the planet. We test for over 100 substances, including metabolites for narcotics, alcohol, nicotine, that includes vaping, medications that can be abused, such as antidepressants, antipsychotics, your benzodiazepines. We will be able to detect any and all substances in that end user's system. So again, the most comprehensive drug and alcohol testing product on the market. The other thing that we can do is we can detect if there are any additives, adulterants, synthetic urine, if someone has substituted their urine for someone else's, if they have stored, maybe when that individual had clean urine, if they have frozen urine that maybe was clean at a certain point of time, maybe if a client has shaved some of their medication into this sample. We have seen it all. Our testing process is able to identify any attempt at manipulation of this. And the reason this is so important is because having a foundation of knowing exactly what's going on with that client or that patient is extremely critical in the treatment planning process. So the Sharetek DNA confirmed at-home drug testing process is extremely unique in the marketplace today. One of our goals is to bring dignity back to the drug testing process. Let me say that one more time. One of our goals is to bring dignity back to the drug testing process. No more observed collection, no more trips to a lab, no more humiliating process that involves a very, very key component of one that may be struggling with substance use disorder or just for employment testing. There is a new way to do drug and alcohol testing, and what we've built at betterdrugtest.com is really changing and disrupting the way drug and alcohol testing will be done for the future. We invite you to find out more information. We'd love to support your mom, your dad, your brother, your sister, your son, your daughter. Drug and alcohol addiction impacts 20% of the United States. That's 1 in 5. So it impacts almost every family. And if it's not directly in your family, I know that you're thinking of someone right now that may be struggling with drug or alcohol addiction. Unfortunately, the problem is getting worse, not better. In 2020, the drug overdose deaths rose dramatically to 93,000 individuals. Now, I know that that is often overshadowed by the global pandemic with COVID, but drug and alcohol addiction, and specifically overdose deaths, are getting worse. Now, we here at Sharetek aren't saying that we can make that number go away, but with a more dignified approach to drug and alcohol testing, we do feel that what we can offer through this very unique method will lead to an increase in compliance and will actually, and we've seen this over and over again in providers, once individuals understand that this drug test cannot be cheated, it will actually lead to better conversations between the care provider and the individual about what exactly is going on with their drug and alcohol use. One of the other major benefits of this testing process as well is the reporting. The reporting is so easy to use and so easy to understand, and we simply highlight any of the areas where we have seen detected substances right at the top of the report. You do not have to be a clinician or a licensed or trained professional in order to interpret these results. One other additional important item in the testing reporting side is that these are quantitative results as well. What does that mean? It means that you will see the levels of the substance that that individual has used or drank. This is a critical component, whether you're using a harm reduction approach or you really want to see that someone is tapering off whatever substance that they may have been using. This is a critical part to successful treatment planning, and the Sharetek test will be able to identify that for you. So something that's really key as part of this process is knowing the levels of the substance that the individual has been taking. And we will be able to identify that very clearly and easily on that report as well. So again, not just a point of care cup that is a yes or no. And if you're looking to see a line on a little cup after you've spilled urine on a countertop and really have made a mess, and that's only if you have performed an observed collection where you can ensure that that client provided that sample. That entire process goes away. The Sharetek process is designed to support people. It is designed to bring dignity back to the drug testing process. Again, my name is Steve Moak. I'm CEO and founder at Sharetek. I am a person in long-term recovery. We are here to disrupt the entire drug and alcohol testing industry. Please reach out to us. Let us share how we can work with your provider organization, or we can support your loved one through this very unique drug and alcohol testing process. Thank you so much for your time, and we look forward to working with you.